culture is the middle, is the heart of everything we do at IAHA.
I found a home in IAHA.
About all these amazing opportunities that I've had.
And we have a very good vision.
Allied health is diverse, providing a broad range of identification, evaluation, management, prevention and rehabilitation services to improve the health, social, emotional and cultural well-being of those they support. IAHA brings together and collectively supports Aboriginal and Torres Strait Islander peoples across 28 allied health professions. The allied health workforce is essential across health and related sectors, including mental health, disability, aged care, education, community services and justice.
Allied health is such an important sector to complement and support the whole of health because we do things in a very holistic way, in a comprehensive way, and we work with the whole person.
Led by the Aboriginal and Torres Strait Islander workforce, IAHA aims to improve the health and well-being outcomes of our people. We work to support and grow the Aboriginal and Torres Strait Islander allied health workforce, transform the health and education system with culturally safe and responsive practice, eliminating racism, and provide national leadership and expertise in Indigenous health and well-being across policy, research, and workforce planning.
IAHA supports allied health professionals through every stage of their career journey.
Those supports are invaluable to helping Aboriginal people get through the system.
Challenges for me was moving away from my family.
My country, my connections.
I was an adult learner. I went back to uni.
Let's not forget the education system is essentially racist. It doesn't mean to be, but it just is.
Being the only Aboriginal student within my course, I found it a little bit difficult.
We have many scholarships that students and graduates can apply for throughout their time at university.
So I found a home in IAHA in the sense that it was much more committed to interprofessional education and much more clear about that healthcare can't be delivered only in the hospital or in the clinic. Good health and wellbeing outcomes are delivered in homes, in schools, in communities where people live, and I think IAHA and the allied health professions in general understand that more than most.
About all these amazing opportunities that I've had, the Health Fusion Team Challenge, that value and appreciation for teamwork and interprofessional knowledge.
Is to be able to come to conferences like this and be able to spend time researching culture and country with people who have that knowledge.
Workforce development is central to IAHA's work as leaders in the allied health sector, and IAHA has provided an Indigenous perspective for achieving success in allied health. 5 domains represent the allied health career journey and support the long-term growth of the Aboriginal and Torres Strait Islander allied health workforce. They are pathways into allied health, student support and engagement, transition to early careers for our graduates, allied health career development and support, and enable future workforce development.
Aboriginal people's success and graduation rates is not a function of individual compliance or capacity. It's a function of how much that system is willing to help them navigate their way through an essentially alien, unwelcoming and white system. All of the evidence internationally shows that when you support Indigenous students properly, that Aboriginal graduates will succeed at far beyond their expected completion rates.
IAHA supports the individual along this path with mentoring.
Through IAHA, I was given a mentor.
Well, mentoring has been a really important part to my allied health journey as a student and even as a graduate and even now 6 years down the line.
I find it helps me both culturally and professionally.
Bounce ideas off, reflect on some practice, maybe get some feedback.
That helps, supports, educates, gives people advice and nurtures them into finishing their degree.
Leadership development.
I've been told I'm the leader, but I think it's hard to identify the actual characteristics.
I think it's critical to have strong Aboriginal and Torres Strait Islander leaders.
To inspire our communities and our peoples to continue to study in.
Being a leader is speaking out, working with people, collaboration.
But also that insight into the intergenerational trauma and...
So that Aboriginal health is in Aboriginal hands.
And cultural responsiveness and safety.
Cultural responsiveness is essential
Doesn't matter if you're Aboriginal or not, I think everyone should do them.
With our cultural responsiveness framework, we want people to focus on themselves.
The work of cultural safety and racism, for example, and dealing with that in our system is all about values and beliefs.
You know, knowing the culture, the spirits, different ways of working, different ways of living.
Knowing about the chronic disease and the health problems that us as Aboriginal people face.
Aboriginal and Torres Strait health professionals bring to any workplace is not just about how to improve Aboriginal and Torres Strait health outcomes, but actually to improve health outcomes for non-Aboriginal people by virtue of Aboriginal knowledges about wellbeing.
It's also about making sure that we eliminate a lot of racism from the allied health workforce and also from the total health system. I think supporting the allied health workforce will help close the gap.
Our greatest challenge, but also our greatest opportunity, is to be proactive and to think through strategy well ahead of time.
Indigenous people need to be able to have more of a say in kind of what health they want to have as a people, involving them in the decision-making process, but also the planning process.
We need to ensure that funding is allocated to an Aboriginal community-controlled health organisation to ensure that that money is in Aboriginal hands and they're the ones delivering the health, wellbeing services to Aboriginal and Torres Strait Islander people.